So far, we see that it's not easy being a caregiver. They are underappreciated. They don't have enough support from federal governments, from local and state governments, from private companies. Sometimes these also include their own employers, from insurance companies. Many of the things they do for the person they are caring for are not covered under their insurance policy or the person's insurance policy. There's a lack of social services in their area. They don't have enough support from the local communities. They are invisible. People don't realize they exist, but they do a whole lot. That is why they are so stressed. And because of that, the government, non-profits, different organizations in any neighborhood, or employers should make accommodations for their employees who are caregivers. And they should revise their policies. The HR should revise their rules and regulations and policies. Okay, so they also classify the different needs, support needs, different issues, challenges faced by caregivers in different continents. You can read this on your own. And apparently, the demands for caregiving increased after COVID, even to this day. I think maybe some adults, they discharge their parents from the nursing homes and they care for them. This is one reason why their work will increase. Or sometimes the nursing homes, long-term care facilities discharge those patients. This also increase their demands. And the responsibilities for caregivers may have changed after COVID. Their expectations increased and also may have changed. And many of the expectations are more urgent after COVID, especially if prior to COVID, some of these responsibilities were being taken care of by nursing homes, by others. From some hospitals, whether from essential or non-essential services, maybe now all these services closed down. It increased their responsibility and changes their expectations. They feel overwhelmed burnout, and they have financial stress. You saw, they have to pay from their own pocket of many things for the person they are caring for: food, other basic necessities, technology gadgets, and so on. Special beds, special clothing, special mattress, among other things. So they experience increased financial burden that people may not be aware. Their careers are affected, especially for women. So every country around the world should realize that in the midst of this pandemic, caregivers, most of them unpaid, are doing a whole lot. People don't realize that. People take them for granted sometimes. And this is what countries, non-profits employers, and other public and private entities need to do for the caregivers. They need to continue to safeguard their physical and mental health and other aspects of well-being. They need to compensate them, not cut their pay. Be flexible with them. Give them subsidies if the need warrants to release their burden, because many of them are unpaid. Give them more information on support system, resources, other assistance in the local community. Maybe educate them on how to become a caregiver, especially for first-timers. And once again, employers should be more flexible. And more research should be done on caregiver stress, their needs and their priorities. And caregivers should have access to COVID-19 vaccines. Maybe it's more challenging for many developing countries to get access to these vaccines, whether they are caregivers or not. And caregivers should have free PPEs or subsidized PPEs. And yeah, they need more support networks. Sometimes online groups or even certain organizations where they meet in person may help the caregiver. By having these support groups, the caregiver may realize that I'm not in this alone, right? More training and counseling should be given to them for free, because most of them are unpaid. And policy makers, employers, other entities should recognize the contribution caregivers make to any society. And caregivers are doing all these things. Preparing meals can be very time consuming. Home maintenance and housekeeping also very taxing. Transporting the person they are caring for. This is not easy if the person is on a wheelchair, if the person has some sort of limitation or disability, or if the person is mentally off, is also challenging. So government should support them so that they can do their jobs better. And 2/3 of the caregivers say employers do not support them. And subsidies should be given for their transportation, groceries, and meals. And caregivers should have access to respite programs. They should know all respite programs should be built in different communities for the people that need care for. And information should be more user-friendly, should be easy to access. And employers should be more flexible. Employers should be more understanding. And once again, more programs should be created to support them. Once again, flexible work hours. And the government should work with employers, maybe provide some tax break or something, so that employers can better support their employees who are caregivers. and more research is needed. More grants are needed to fund this research to better identify the specific needs, challenges they face, and priorities of the different kinds of caregivers. And here are the few resources available. You can read this on your own. And this is the sample. Majorities of the respondents are females. The sample is quite large. It consists of respondents from 12 countries. It's quite large. Majority of the caregivers live in suburbs or cities. Slightly over half of the caregivers are also parents. So they experience sandwich burdens, caring for their own kids and caring for their own parents. Wow, a somewhat higher percentage of the caregivers are millennials. They are somewhat young. They need more training, more guidance, more awareness of support system and other assistance. Some or most of them are first timers, and the percentage for Gen X are also high for my generation. And for caregivers from Gen X and the baby boomers generation, they are sandwiched between caring for two generations, their own kids and their elderly parents. Wow, majority of the caregivers are employed. So there should be some sort of a public-private partnership or cooperation. Government should give tax breaks to employers so that they can have more programs for employees who are caregivers, more flexibility, among other things. And majority of the caregivers do not make more than 100,000. I think this should be US dollars equivalent. Okay, most people are caring for females because it's a no-brainer. Females live longer than males. And most of them caring for those 65 and over. Nearly half of the caregivers are parents. And oftentimes individuals they care for have all these chronic physical and mental health conditions. And it seems that nearly 40% of the caregivers in India is higher than other countries are first timers. They are relatively young. This could be partly due to the higher fertility rates in India and the higher population in China. Or because some of these countries are highly patriarchal. So younger adults are more expected to care for their own parents compared to other countries. Wow, nearly all caregivers in Taiwan, China, and India, highly patriarchal countries, are unpaid. And the percentages are also high in many of the Western countries. It's relatively low in Germany and France. Maybe they have better support system, but the tax rates in these countries are also high. And most caregivers are caring for their parents. their own parents. And most caregivers are inexperienced. They have no more than 5 years of caregiving experience. So they need more help. Because of that, they are so stressed, especially after COVID. And on average in a week, before COVID, caregivers spend less than 20 hours for every country combined. Caregivers spend no more than 17 hours caring for somebody. And it shoots up after COVID. It shoots up when COVID was high. The cases were high. It's still high. It hasn't declined to the percentages before COVID. It's the same if we break it down by country. And some caregivers spend more than 20 hours a week caring for somebody. And these are the top responsibilities of caregivers. And the percentages may vary by country. You can read this on your own. And nearly half of the caregivers in some countries, in Canada, UK, Brazil, or even the US, say that the person they care for rely heavily on them. So when we see so many statistics, the evidence tells us that caregiving is very, 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 very stressful. And majority of them thinks that pandemic makes it worse. And only less than half of the caregivers say that they are appreciated. And this is quite encouraging. Majority of the caregivers, they say that what they do is also rewarding, even though it is stressful. This can be due to the person being cared for. When they develop rapport and trust with the caregiver, they will try to be more appreciative of their caregivers. So this is encouraging. And well, nearly all caregivers say that they make more sacrifices in their personal life for the person that they care for after COVID. So this tells us that caregiver stress increased after COVID. Majority of the caregivers say that it affected their careers, especially after COVID. This is even so in highly patriarchal countries, China and Brazil. And majority of the caregivers, except for India, says that caregiving affects their mental health, affects their financial well-being, affects their career prospects. And caregiving duties also affect their physical health. And caregiving also affects their social life. The percentages vary by country. And COVID-19. Being a caregiver during COVID-19 has worsened their mental health, their financial well-being, their physical health. And they feel more isolated because of social distancing lockdowns. And they feel isolated, more isolated after COVID because they have more demands and responsibilities. They have less time to hang out with their own friends and families. They are more worried during COVID. And they spend more money towards caregiving responsibilities, not being compensated after COVID. And some think that government assistance support services are not enough, inadequate. And they have to cut back their hours, and they have to spend all this money towards caregiving. They have to reduce their hours, especially during COVID, to care for someone. Their income is affected because of caregiving in the midst of this pandemic. And you can read this on your own, how they are spending for food, healthcare, other household bill changes during COVID. And they are sleep deprived, they exercise less, they postpone their own medical appointments. We've been through this in the previous slides, and this just breaks down by country. Some are more severe than others. And the majority of them think that connecting with other caregivers helps. It's a support system. And only a minority of caregivers talk to other caregivers. They are too tied up. And they spend more money caring for the person after COVID. And most have remote work, but they also have to care for someone. And they cannot afford proper care. So these are all the challenges they face. They need to learn how to use more technology and digital tools. These are all the challenges they face. And they face challenges accessing all these support systems, all these services, majority of them. They have difficulty juggling multiple responsibilities. And majority of them, almost all caregivers in some countries, feel that they are underappreciated. And caregivers in all countries, even though their percentages vary, they think that they don't receive enough support by all these entities. We saw this in the previous slide. This slide just breaks it down by different numbers, percentages, sorry. So I'm at the stopping